It's been toasty lately during a time when many students are heading back to class. And while the heat might be uncomfortable, it also has the potential to turn dangerous. Dr. Travis Henson, ER physician with Dignity Health St. Bernardine Medical Center, joins us live with what parents need to know. Good morning, doctor.
Good morning, Tony. Thanks for having me.
Absolutely. Well, what kind of heat-related injuries do you see at the ER during the school year?
Most of the heat injuries that we see include things like sunburns, heat exhaustion, and also heat stroke.
And these are coming from kids from school?
It can happen with kids from school. Fortunately, we don't see it that often. And the reason is oftentimes whenever temperatures reach dangerous highs like 103 or more, schools tend to keep kids indoors more, which is smart.
Yeah, there's certain protocols I know for sure at my school for my kids that they have to stay inside. But so you said 103, that's when they're considered dangerous?
At 90 degrees, we start seeing sort of what's called a high risk zone, and that's heat index, right? So that's temperature plus humidity. But when you start hitting 103 and higher, and particularly when you're up at 120, 125, I mean, it can really get dangerous, and kids can dehydrate within, 20, 30 minutes, especially at 103 or higher. At 125, I mean, people can dehydrate within 10 minutes.
Oh my gosh. What should parents be mindful of when they're talking to their children about when they go to school and when there's heat going on?
Yeah, kids forget to drink water sometimes, and kids sweat less efficiently than adults. And not to mention, when they get to playing, they forget to drink water. And so they really need to stay hydrated. So, sending your kids with enough water to school, making sure to tell them to drink water. Also, telling them things like, hey, find some shade. If you're feeling hot, you start feeling fatigued, muscle cramps can be an early sign of dehydration. And those kind of things should make them seek shade or even seek the school nurse.
Okay, yeah, so some of those warning signs, can you kind of tell us again what parents should be kind of warning their kids about, like, hey, if you feel this or that, maybe go to the school nurse.
Yeah, so if the child is excessively sweating, that's something to be worried about, particularly if the child starts feeling fatigued, dizzy, nauseous. They won't know what palpitations are likely, but if you say, a feeling of a rapid heartbeat, if you feel your heart beating fast, those are all early signs of heat exhaustion and a reason to seek help.
And definitely, yeah, we all know about water, but how about like the way kids dress when they go to school? Like, I mean, is that important when it comes to maybe heat illnesses?
Yeah, absolutely. If they're able to, shorts and t-shirts and things like that, rather than wearing a jacket or a sweater, jeans can particularly hold in heat. And so, if they're able to wear something a little lighter, or even dress in layers, if it's cooler in the morning and gets hot in the afternoon, that would be a great thing.
Yeah, I think that's the tough thing this time of year is the mornings they could be cool, but then in the afternoon hours or during lunchtime at school, those temperatures can really peak and throw kids off guard.
Yeah, absolutely.
All right, Dr. Travis Henson, thank you so much for those tips, and we'll make sure our kids stay safe out there. Have a good one.
Stay safe. Thank
Yeah,
you.
thanks.